8:11 now. You are taking a live look at the U.S. Capitol this morning. The U.S. Senate is still debating the president's massive tax and spending bill. The House has already passed it, and there is mounting pressure from Democrats, independents, even some Republicans to vote against this plan. Critics argue that it would cause nearly 300,000 folks in North Carolina to lose their Medicaid coverage.
Joining us now is Cody Kinsley. Cody's the former Secretary of the State Department of Health and Human Services, currently working as a senior policy advisor with Johns Hopkins University. Cody, it was your job to oversee the state's Medicaid expansion a couple of years ago. I talked to you many times about it. It provided coverage to more than 600,000 people. Would this undo all of that work?
Well, actually, before Medicaid, I want to start with folks that currently get their health care in North Carolina through healthcare.gov.
Recording in progress.
There's 1 million folks that get their health insurance through healthcare.gov in North Carolina. People like my parents, before they went on Medicare, they were both working. They couldn't get insurance through their jobs, so they went online and got their insurance there. Almost every single one of those 1 million people in North Carolina under this bill will see their premiums go up. Some of them, it'll go up so much that we're going to see about 250,000 North Carolinians lose their health insurance from healthcare.gov. That's before we even get to the impact of Medicaid. And so we're talking about 250,000 or 750,000 people getting their rates up. Premiums. We're talking about 1/4 of folks on ACA losing their insurance. We're talking about 250,000 folks on Medicaid losing their insurance. This is a disaster for healthcare coverage and costs in North Carolina.
And Cody, we know there are different stipulations with Medicare and with Medicaid, and then there are those who are working and are insured and others who are not. The Republicans argue that working Americans won't be impacted. Senator Tillis, in fact, suggesting that undocumented immigrants are the ones who would lose coverage. Is that an accurate description?
Medicaid already doesn't allow for coverage for undocumented immigrants, and the vast majority of folks that are on Medicaid already are working or they're caregivers for sick loved ones. What this bill does is add more requirements and more processes, and I think healthcare is too complicated already. So having to fill out more forms, going to offices more often, it's that kind of sand in the gears that is going to actually drive people coming off enrollment. They're eligible. They just don't have the time in their busy lives, their multiple part-time jobs to fill out forms. And look, nobody is sitting at home on Medicaid getting money from Medicaid. They're all, the providers are the ones that stand to lose out here. And that's where I'm worried most for rural North Carolina. In rural North Carolina, we've had 12 hospitals close over the last decade. With all these folks losing coverage, our rural hospitals are going to feel it first and most.
8:14 right now. A lot of folks watching here on the stream are working from home, and you know what? They might have coverage because of their employer. But you argue that this is going to impact all of us if these people, whether it's on Medicaid or otherwise, lose coverage.
That's right. Look, when more and more people are coming in the front door of my doctor's office and don't have a way to pay, how does my doctor's office stay open? They have two choices. They can either raise my prices or they can close. And that's the story that North Carolinians know well, looking at these nearly 12 hospitals that have closed over the last decade. Too many folks were walking in the front door without insurance. That's why every North Carolinian came together to work hard to get Medicaid expanded, because we understood that by closing the coverage gap, we could help all of us. And we see this in states across the country. When you have lower uninsurance rates, you have more controlled costs. So this is pushing us in the wrong direction.
And you just mentioned, Cody, that there have been several hospitals that have closed. Talk about the true impact for those rural communities. Again, many of them already having to travel miles to get access to health care just because of what has happened with hospital closures, not as many physicians in town close to them.
Well, in addition to the more than 500,000 people that will lose coverage over in this bill, there's also a number of other provisions in the bill that will control how Medicaid gives those rural providers and those labor and delivery clinics in those rural hospitals additional funding so that they can stay open. Look, these hospitals need a certain number of people to come through the door so that they can stay open. And in these small communities that are so vibrant and exciting, there just aren't enough folks that need those services every day to keep them open. So Medicaid gives them extra money to sustain those services. This bill puts those payments at risk, and it pulls more money out of them, putting those hospitals at risk, and they can't balance their budgets, and we're going to see an increased risk of closure if this bill passes as it's currently written.
Do we have a clear idea yet what this could mean for people on what someone called food stamps or SNAP benefits?
Well, this bill takes out about $700 million from the SNAP program in North Carolina, and it actually puts a lot of burden on our counties. Right now, our counties do the work in North Carolina supporting people to get access to food, and so we're going to see county costs go up because the county administrative responsibility. So it's going to actually increase the cost for all state taxpayers if this bill passes as is with regard to SNAP. And look, if less people get access to healthy food, where do they end up? They end up in the emergency department, which is a very expensive place for them to be. So we're going to end up paying even more for this in the long run.
Already this week, we've done stories about food pantries not having enough food to help those already in need. And so certainly not a great situation there. It sounds though like Senators Tillis and Budd are both on board with this plan. What is your message to them as they're going to be discussing and debating this?
I have deep respect for our legislators, and we have been able to work together in bipartisan ways to do things around mental health reform, to support North Carolina. And I really hope that they look very carefully at the details of how this will impact North Carolinians and work to make it better.
Cody Kinsley, former DHHS secretary here in the great state of North Carolina. Cody, good to talk to you.
Good to be here. Thank you.